My name is Dr. Paul Gallardo. Today we're going to be doing a soft tissue gingival improvement graft in the area of 24 and 25, which is basically the two lower front teeth. There's something called the frenum, which is a muscle attachment that goes from the lip to this area that makes it very difficult to do using traditional methods. So what I'm going to do today is a lip extension using tissue from the inner lip to cover the graft, and also to relieve the tension from the lip pull. And this will yield a really nice result. So we've just finished cleaning the teeth, making sure that the plaque and calculus is away from the necks of the teeth. And now what we're going to do is we're going to actually start with the vestibular extension going on the inner lip first. So basically this is the frenum pull that goes from here to the lip. And you can see how it's literally pulling the soft tissue away from the neck of the teeth. So what we want to do is get rid of this pull and at the same time have enough tissue to be able to place our AlloDerm underneath. So now we're going to begin our lip switch incision. So what I do is I measure the amount of recession, and it should be about 1.5 times that to 2. So we're about here, or the extent of the frenum. So I'm going to one nice large sweeping incision. It's a very superficial incision, because the point is not to go into muscle, but just to dissect the mucosa itself. And you can see how the tension just starts to release itself. You can suction with it. Now we'll take the 1-2 pickup, and I'll have my So at this point, you'll see that even though we pull on the lip, go ahead and pull on the lip a little bit, you can see that the tension is very minimal. Okay, so now all we have to do is connect this to this here. Oops, and we have another 15, please. 15C. You can switch. So this is the Allen instrument here. So what we're going to do is we're going to go underneath and start to just really gently connect the base here to the sulcus. No rush, really taking our time to avoid any perforation. A little bit of a twist there. And then we'll connect that. From the top, from the sulcus down to the base. We have a number 6. with the number 6, we'll come in and just make sure that we're up all the way to the top. And we might even be able to release some of that papilla tissue. Suction right in between those two. That's fine. So you can already see the tissue coming up and covering the roots. You have a younger gut. Okay, good. Now we're going to take fraction 3, which is the activated plasma, and fraction 3 is a growth factor that we take from the blood, and we're going to rub and burnish the root surfaces with the fraction 3 growth factors to enhance the connective tissue regeneration in that spot. So this has been activated. And we're just going to moisten the tip of the cotton swab and literally burnish the root. Okay. So now we take our measurement, measure, and we're going to trim our AlloDerm to fit the area of 24 and 25. It's just over 10 millimeters by about 8. So then what we'll do, make sure that the AlloDerm is positioned properly. And we'll go ahead and suture and capture the flap as well as the AlloDerm. And then this will be like a little sling suture. same thing on tooth number 24. We'll capture both the AlloDerm and the exterior flap. And this is going to be also a sling suture. Let's get the bite block out of the way. That might actually be better.